You and I have been having a conversation, especially about this idea of a vaccine passport and whether that is really a necessary item. Well, let's take hopefully a medical perspective on this as well, which is not the only perspective, but certainly an important one. Dr. Marty Makary, a surgeon at Johns Hopkins. He is involved with health policy there and is the author of The Price We Pay, What Broke American Healthcare and How to Fix It. Dr. Makary, always good to talk to you, sir. Thank you for joining us.
You too, Larry. Great to talk to you.
You've been writing and talking so much about herd immunity, and you've said that that's the combination of people with natural immunity, people who have had the virus and have the antibodies, and people who have gotten the vaccine. And that's our goal here, right? We're trying to reach that threshold.
That's right. And it's been frustrating to see so many people like Dr. Fauci dismiss natural immunity, saying we don't know how many people have it and we don't know if it even works. Well, guess what? The data's out there. It's just a matter if you want to listen to it or cherry pick around it. And it's pretty clear that natural immunity is very effective in preventing reinfection, because the study from Denmark just showed in a gigantic population study that the reinfection rate was 0.6% at a time when the virus was everywhere.
That's
so
great
natural
news.
immunity does work.
And so here's my big question here as we heard all of this discussion over the last 48 hours about a vaccine passport, because we have faced pandemics before, sir. I remember the swine flu when I was young. I've read about polio and all those things. Obviously, we have a national vaccination policy for public health consideration, and it makes sense. But do we usually keep track and keep records of and make people walk around with cards that show if they've received that vaccine or not? It's so individualized and personalized that you can now only access certain parts of our society if you can prove you've gotten the vaccine? That seems like a new development.
It is new. I see it as a way to allow people to have certain privileges, to do things that are recreational or entertainment. For example, we can pack more people into a public setting if we know that they're immune. And rather than just take someone's word for it, some organizations are saying if you can show us that you've been vaccinated, even if you're 4 weeks out from the first vaccine, you've got pretty good protection. I don't think it's something we should require as a condition of employment, but for now, for a little bit longer, it just doesn't make sense to have these businesses, restaurants, and other public gatherings and venues closed and restricted when you've got a lot of immune people who can safely enjoy those places.
So now this is critical, because you're saying it's until when you say on a temporary basis, you're talking about until we reach that magical moment of herd immunity, right?
Yeah, soon. I think the summer is going to be a great summer. I don't think it's going to be a sort of a day when we, hit the big gong and we're all in the clear, because
right.
Herd immunity is gradual. It's increased slowing, but we're almost there. I mean, look at the preview of what we have from Israel and the UK. It's pretty darn impressive, and we should be there soon.
So, and this is what I think is confusing people who are trying to follow this. The suggestion, I think, is unless you get the vaccine, you are vulnerable not just to getting the virus and getting sick, but you are vulnerable to passing it on to other people. And you're saying that it's not necessary. This is not about every single individual in our civilization getting this vaccine. It's just the right number of people getting it, and then you're sort of in this new zone, right?
Yeah, we already have herd immunity for healthcare workers and nursing homes, and some parts of the country are basically almost there. Los Angeles, for example, has had a 95% reduction in cases. Their positivity rate is like 1.4%. They're doing well. So we're going to see it in different parts of the country roll out through April and May.
So there's also a lot of misunderstanding, I think, about the vaccine, and I would love for you to clear it up as well. There are some people who say if you get the vaccine, then you can't get you won't get the virus, and you can't pass on the virus. There are others who say, oh, you can still get the virus, but your antibodies are built up in such a way that they'll be able to fight and kill the virus before you become symptomatic. What is the reality of this?
You can always get the virus, but the chances are very low. And we don't worry about one virus particle. We worry about a viral burden that gives you illness. And so when you have vaccinated immunity, or you have prior infection that's giving you natural immunity, your body fights that virus as soon as it lands on the mucosa. And so it's very effective. I think this idea of oh, we know that the vaccine prevents you from getting the virus or getting sick or testing positive, but we don't know if you can give it to someone else. We can use some common sense. I mean, isn't that what Dr. Fauci used to rationalize the double mask? Was he said the scientific rationale was common sense? Can we use a little common sense here?
And to that end, because we know that it is true. I shouldn't say we know. You tell me. Asymptomatic transfer of this virus is a thing, and that has been a problem, right? You can get it, you can be asymptomatic, but you can still pass it on to someone else and make them sick.
That's right, and that's how we got burned on this thing. And when you see Rochelle Walensky, being very, very worried and concerned and scared, as she says, in her statements today, where was that sentiment before the pandemic started? That's what we needed then. Now you just can't jump. The pandemic can't jump back to the levels where it was back in January, unless there's some unforeseen new variant we haven't seen yet.
Right.
It's not like a stock price. It doesn't just jump back up. I mean, every other person in a room has immunity, and so super spreading events are far less frequent and likely now.
So then help me out with this. So because you said the vaccine does not prevent you from getting the virus necessarily. How is that different than having being asymptomatic? In other words, if I get the vaccine, I can still contract the virus, but can I also theoretically pass it on to somebody else, or is it such a low?
Yeah. Go ahead. You were about to say it. That's exactly right, Larry. It's the amount of virus. It's the viral burden. So if you really only transmit it when you have a certain level of the virus in your nasal mucosa, in your respiratory system. Otherwise, just getting one virus landing on your body technically could give you a particle, but it's not enough to cause infection, and it's not enough to transmit it to somebody else.
So let me regurgitate all of this here, and you fill in the blanks. What you're saying, Dr. Makary, is we're actually, in some sectors, we actually have reached herd immunity. We're very close across the board here. People still should get the vaccine and should have access to the vaccine. They should have, it should be their own personal choice. And in the interim, as people are vaccinated, they should be able to enjoy restaurants or a baseball game or an airplane or what have you. Showing that vaccine card will allow them to be able to do that, but eventually that will be unnecessarily, probably relatively soon here, and it'll be unnecessary in that there will still be people who have chosen for their own reason not to get the vaccine, but that won't really matter in the long haul. Is that right?
That's right. And I would tell people you could summarize that complicated CDC guidance of what you can do by this simple principle. Get the vaccine, wait 4 weeks, and live a normal life. That's the formula, and that's what we need to help people that are in this horrible state.
So why aren't the people in charge
isolation.
of our public health policy saying exactly that? See, that message will get people out there getting the vaccine and going back to normal, doctor.
Well, that's why I wrote the Wall Street Journal piece saying exactly that. I just think that there's a failure of messaging. And when you're out there saying gloom and doom and the sky is falling, I mean, look, I'm concerned about the virus too. I'm telling people to be careful, wear your masks indoor in a public gathering. If you're in a public indoor gathering, just wear your mask a little bit longer till we get to a better spot. But we've got to get out there and reestablish human connections and hug our loved ones. And so the message should be simple. Get your vaccine, give it 4 weeks, and then give somebody a hug.
Dr. Marty Makary, Johns Hopkins University, and the book again, The Price We Pay, What Broke American Healthcare and How to Fix It. Doctor, always good to talk to you. Thanks for answering a lot of our questions today.
Good to be with you, Larry.